Hello, everybody, and welcome to our podcast, Unmuted Mayhem. Today, our topic is the redundancy of healthcare in Ireland. So, Jack, if you want to start us off.
Here on my part, I'm going to be talking about the viewment and the treatment of nurses within Ireland. We're going to start off. I would like to talk about the gender bias that is generally there towards women. Statistically, there are 88% to 95% of nurses in between the UK, US, and China that are women, but there's a small percentage that are still men as well. Being a man in the nurse field is still frowned upon in many of these countries, just based on culture.
Mental, by the way.
Yeah, like China. It would more so be China and say the US, with the standards being put in there between it. But there's also a big pay gap between men and women, primarily in England, more so than the US. And if we're still talking about nurses, I'd like to also bring to the attention that during the COVID-19 pandemic, we had plenty of student nurses that were asked to work overtime when they were doing their student internships without pay. You'd have many of them getting about 50 quid a week, and they wouldn't be getting any other sort of payment. It would just more so go towards their credits. But even with that, the credits didn't really matter because they were putting themselves in danger. Just like I said earlier as well, there's a big gender pay gap that is happening in nurses. There were 6 separate journal articles that were done about the gender pay gap, and in most of them, the highest earners or the highest pay brackets were all men.
Which is, like, obviously, that's experienced in so many careers and job choices, like, worldwide. But to have it still be there after everything that's gone on, even in sports where women have strived to seek equal pay to men, football teams have started doing it. Like, it's crazy to see that even people that are saving lives have to deal with it on a day-to-day basis.
But even like that, it's more so in the UK that the studies are done. So Northern Ireland actually has the lowest pay gap between them. Men and women in Northern Ireland are fairly equally paid. But in Scotland and Wales, that's where the biggest gap occurs.
That's kind of mental, actually.
Yeah.
That the North have
like if the North
such a
is,
small pay
if
gap.
I'm not mistaken, the pay, like, they're very equal to pay in the pay brackets with women. They don't get, nurses in the North though just don't get paid nearly enough compared to mainland England. They get paid a lot more. They would.
That's mental.
It's just a weird system. Even though they're all with the HSE, it's just such a weird system that they've going. And like even with that though, like media nurses is another really big thing that we need to talk about. Like the view that nurses have, or the perception that are made of nurses through media. Like look at Grey's Anatomy, look at the what's that new one that came out? The Pit.
The Pit, yeah.
The Pit is a really big one, like how nurses are perpetuated through that. And even when a doctor makes like a big discovery, a nurse is never credited it. When a study comes out, it's just by, say, Dr. Norton, a male doctor. He's they're the only ones to get the credit. But in my opinion, it's the government does have a bit of a part to play in that, if you ask me, because they kind of perpetuate the system that it's not really, there's no mold to be broken. And I know that Leo, you have a bit to say about the government and how they set everything up.
I do. Currently, the government employs a strategy of mixed public and private healthcare. This means that alongside tax-funded care, such as what provided by the HSE, people can choose to opt for privately funded hospitals and clinics. The main advantages of that system is that those who cannot afford to pay for private healthcare aren't left behind altogether. This is done through medical cards for low-income individuals, which grant them free GP visits, dental care, and hospital visits.
Which is mental, by the way, because like for someone who has a medical card, like I was in the hospital on Monday because I sprained my ankle and I got in for free, but then there's so many other people that are paying hundreds of euro
ludicrous money,
per visit, per dental visit, all of this. It's crazy to actually just see from the outside.
Even like GPs, it's crazy. Like I got a blood test done, and for it to get read over the phone to me alone, it was €35. For me to go in for a visit, then it was €75. Like even with a medical card, that still doesn't. I still have to pay that for my GP, and because I don't qualify for a medical card now, even though I'm asthmatic. Like it's ridiculous the standards that they have set for it. Yeah, like the standards that they have set is ridiculous.
So how do you get the medical card?
I get it through disability. So I've autism. So it's a long process to get it, but once you get it, the long term benefits are massive. But then for people who actually need it and don't get it and are constantly going into the hospital with people with like autoimmune diseases, all of this, and they're struggling to get by.
It's ridiculous. Like,
It's ridiculous.
yeah.
But anyway,
Well, yeah, the publicly funded hospitals, they tend to lag behind the private ones because of overcrowding and insufficient funding. As well as this, the private sector fails in the cost department, leading to more people getting priced out of adequate insurance and placing even more strain on the public hospitals. In March of this year, following a series of price hikes across the sector, the average cost of a health insurance premium rose to over €1,900. And on the other hand, the greatest challenge faced by public hospitals is overcrowding. As of the 10th of April 2026, more than 950,000 people are on national public hospital waiting lists, according to RT, which is roughly 17% of the whole population.
which is mental, because even like where we live, Leo, obviously, as I've said, I frequent hospitals quite a lot. Quite injury prone, if you couldn't tell. But Nace Hospital, I was in there a couple months ago, and you can't get a room overnight. You can't. You're in the hallways. There's people literally lodged outside the X-ray room, so you have to move somebody to be able to get in. There's no beds anywhere, but in Nace, they have so little space that there's people actually sleeping in the hallways.
Yeah.
Some are even having to sleep on chairs, which is baffling for a medical centre.
But it's not even the fault of the medical centre, it's the fault of the government for not giving them the proper amount of funding.
Exactly.
Even with like the new kids hospitals
The
coming in.
kids' hospital in
Like
the
that
middle of town.
Like that just
that
caught fire the other
to.
night as well, like so that's gonna push back even further now.
Yeah.
Yeah.
And it's in the middle of town, so by the time you get an ambulance there, what's the cost of it? Like,
Exactly,
And
and
even
then
when you get an ambulance, you actually aren't even guaranteed to be seen when you first go into
Yeah.
anything.
this is
Like,
this
which
is the
is
problem.
just mental, because like, what's
Baffling
the
to me.
point of getting an ambulance then?
they're not gonna get seen, like
Yeah.
Yeah. The government has pledged to add a further 4,300 beds by 2030, but most experts believe that that won't be enough. A study conducted in 2018 revealed that given the population growth, there is a need for 6,300 more beds.
that's
They also said that they'd have the children's hospital up and running by now.
They-
By now.
but like when was the last time they said when was the last target they gave? Was it May this year, June of this year that they said they'd have it done? And it's
Yeah.
getting pushed back further.
And it's still not done.
As it is the most expensive hospital in Europe. Like they
It is,
blocked
yeah.
that. Yeah.
Yeah, the original cost was 850 million euros, but now it's gone over 2 billion already now.
It's
Yeah.
Like,
it costs more, I think
astronomical.
it's the same price nearly that it costs to make the Burj Khalifa in Saudi Arabia
Yeah.
than it is to make this hospital.
Only Ireland, eh?
Well, to overcome all these issues, the current plan for the government is they've allocated 25.8 billion euros to the health sector and begun to roll out the new Sláinte Care strategy. This is to aim at this to like replace the two-tier strategy with a single-tier strategy, where people can receive healthcare based on needs rather than means. And they're also redeveloping the HSE into 6 new like community-focused health areas.
Yeah.
And I guess that actually kind of leads into yours, Ava, of just women in the cancer system.
Yeah. So what I will be talking about today is Vicky Phelan, and anyone mainly over the age of 16, especially women in Ireland, would know that name. Unfortunately, Vicky Phelan has passed in 2022, but back in 2011, she went and she got a diagnosis for cervical cancer. She got a cervical cancer check, and they said she was in the all clear, nothing wrong with her, she was totally fine. And then in 2 years later, she found out she actually did have cancer, and the HSE knew because there was numerous cases, and also the lab in Texas knew that where she got tested. And then by 2018, she was determined terminal, which is very sad, as she had 2 young kids at the time, and when she did pass, she was only 43.
It's shocking though, like was that a sense of pride on the HSE that they don't want to let slip that they messed
They
up so
tried
many
to
times?
cover up so many times,
Yeah.
and she just came out about it, and there's such a taboo of like obviously going against the HSE and
Yeah.
everything. Like she made it clear, and she was such an advocate, even though she was so sick, like to come out, and she wrote memoirs and stuff like that. But there was 220 other women that also had cervical cancer, and they were in the clear, which is just, it's just mental. But there was a study done on her, and if she had been diagnosed by the time like when she first went in for a cervical check, she had a 90% chance to survive, and she only survived 8 years, unfortunately. But even with all, you know, me and all the struggle she went through, she was still an advocate for women's health, and she still was on morning talk shows in Ireland and the UK, and like saying girls still need to get checked out, even though this happened to me, but you know, they still need to get checked out, which is just not on in this day and age.
It
Like,
just
what do you
shows
mean?
how powerful a woman she was in her,
Yeah,
even in her
very
sickness, she
strong.
was still advocating for other women.
Yeah.
So
And it's just not like good enough in this
No.
day and age.
I think it's just like the shockingness of the pride that they had, that they couldn't admit that they were wrong.
Oh,
to save
yeah.
up, save like all them women. Like, what would you say? 220? Did you say?
220
220,
women.
not including her. Like, that's absolutely
That's
disgraceful. It
awful.
is.
No.
On a medical stance as well, Ireland's been one of the biggest pioneers, and like,
Yeah.
we're very
We're supposed to be a
pro-
modern country,
Yeah.
like we're supposed to be like well established. We're not like in poverty or anything like that. And then you look at this and you're kind of just, it sets us back 100 years. Like this
Yeah.
was only recent. Like
And
she
to
only
play that.
passed in 2022.
exactly, and to play devil's advocate of this, the HSE COVID then came in, so the HSE got so much praise for how they
Yeah.
dealt with COVID, and this just allowed them to sweep this under the rug. Like I had no clue until I said it.
But even now they're getting a lot of slack for how they handle COVID. Like a lot of ex-HSE members are coming out
Yeah.
and they're giving out saying, oh, we might have reacted a bit too harshly, or we were a bit too overzealous in the fact of the length of the lockdowns or how strict the lockdowns were.
Yeah.
But they're only saying this now after they came out. But I can understand that it's like, we've never had a pandemic like that before.
Yeah.
But
No.
for so many of them to get these praises and now they're trying to like shift it back, it's a bit weird. In all honesty.
Think that also like aligns with, you know what I mean, it not being good enough as well with the cost in this day and age, which Connor will talk about now.
Yeah, so just while I was looking into everything, the cost of cancer treatments in Ireland and across the globe is just extortionate, so that it comes to a stage where even when you're diagnosed and you start your treatment, it might not actually work. So you're paying, so say for stage 3 colon cancer, you're paying €48,000 for it might not even work. And it's just baffling because I know so many people who've had cancer. My auntie had breast cancer this year. My other auntie on my mom's side had ovarian cancer. And the cost of it is nuts. My granddad's had colon cancer. Like, it is just baffling how.
You're
And-
investing all of this money and your time and
Exactly.
your health, and it's not even 100% guaranteed.
And now, luckily, I'm lucky enough that all of my family survived. But then there's people out there who have gone bankrupt and still lost their family member. And
There's
even
no help given, and there's no
this is what I mean.
and like little support. Like, you know, you don't even know where to look to get the support
Exactly.
to these families.
And like someone will go into remission after 3 to 5 years, and suddenly all that help they were getting goes away, and they fight for themselves, and you have to fight for every appointment you get. So even I was looking at an article by Ocean FM actually, who said that for cancer treatment to have the best hopes of working, chemotherapy should ideally start within 15 days after the diagnosis, but that after those 15 days, every week that passes increases the chance that it spreads to other parts of the body, spreads around the part that's already infected with cancer. And that means like patients are paying the price because according to the ICS, the Irish Cancer Society, there is a lack of staff, space and equipment for all of these people. But there's more than 220,000 people in Ireland living with cancer, which is a 50% increase from a decade ago. And there's still the cost is still unbelievable. So that kind of just shows the country.
Even
really.
with the cost though, say if a person in Ireland can't afford treatments for cancer, they're kind of forced to deal with their own mortality at that rate. They're kind of forced to accept, like,
Yeah.
this is gonna kill me. Do I want to don't want to like go through and get the treatment and still have a chance of dying, or do I want to just accept it, go along with it, and live my last few days like in peace, not in pain from the chemotherapy, still able to get out of bed. It's like they force them to deal with their own mortality, and if they can't afford it, it's horrible. That's
Because
a
if they get the cancer, then like you can't really go outside,
Yeah.
you can't visit people, and then like it truly strips your soul away. But then if you think, oh well, look, I'll just survive with the cancer, like, you know what I mean, just live out the rest of your days. Sure, you're gonna be in pain, you're coughing up blood, you know what I mean. It's
a horrible
not-
thing to have to
yeah,
be faced with. Like,
100%, and there's no support. There's lack of like insight into the like the person with the cancer, but then there's no emotional support as well.
Yeah, well, that kind of wraps up our podcast today. Thank you everyone for listening, and we can't wait to get back for our next podcast.